California Free CNA Practice Test with answers 180 questions full review. Question 1. How often must a resident in physical restraints be released? Option A. Once every hour. Option B. Every 2 hours. Option C. Once per shift. Option D. Only when they need to use the bathroom. The correct answer is option B. Every 2 hours. Regular release is required to check skin integrity, provide range of motion, and offer toileting. Question 2. What is the single most effective way to prevent the spread of infection? Option A. Wearing a mask at all times. Option B. Using double gloves. Option C. Washing your hands. Option D. Keeping all residents in their rooms. The correct answer is option C. Washing your hands. Hand hygiene is the foundation of infection control in all healthcare settings. Question 3. Standard precautions are used for which group of residents? Option A. Only residents with known infections. Option B. Only residents in the intensive care unit. Option C. All residents whenever providing care. Option D. Only residents who are coughing. The correct answer is option C. All residents whenever providing care. Standard precautions assume that all blood and body fluids are potentially infectious. Question 4. What is the correct order to put on personal protective equipment? Option A. Gloves, gown, mask, goggles. Option B. Gown, mask, goggles, gloves. Option C. Mask, goggles, gown, gloves. Option D. Gloves, goggles, mask, gown. The correct answer is option B. Gown, mask, goggles, gloves. Putting the gown on first and gloves on last ensures maximum coverage and protection. Question 5. What is the correct order to remove personal protective equipment? Option A. Gloves, goggles, mask, gown. Option B. Gown, mask, goggles, gloves. Option C. Mask, goggles, gown, gloves. Option D. Goggles, gloves, gown, mask. The correct answer is option A. Gloves, goggles, mask, gown. Removing gloves first prevents the contamination of the rest of the removal process. Question 6. What is the definition of Fowler's position? Option A. The bed is flat. Option B. The head of the bed is elevated to 45 to 60 degrees. Option C. The head of the bed is elevated to 30 degrees. Option D. The resident is lying on their stomach. The correct answer is option B. The head of the bed is elevated to 45 to 60 degrees. Fowler's position is used to facilitate breathing in for residents during mealtimes. Question 7. Semi-Fowler's position involves elevating the head of the bed to how many degrees? Option A. 15 to 20 degrees. Option B. 30 to 45 degrees. Option C. 60 to 90 degrees. Option D. 0 degrees. The correct answer is option B. 30 to 45 degrees. This lower angle is often used for resting or for residents with certain cardiac conditions. Question 8. Where are the strongest muscles in the human body located for lifting? Option A. In the back and neck. Option B. In the forearms and wrists. Option C. In the shoulders, upper arms, hips, and thighs. Option D. In the calves and ankles. The correct answer is option C. In the shoulders, upper arms, hips, and thighs. Using these large muscle groups helps protect the smaller, more fragile muscles of the spine from injury. Question 9. How often should residents who are confined to bed be repositioned? Option A. Once every 4 hours. Option B. Every 2 hours. Option C. Once per shift. Option D. Only when they ask to be moved. The correct answer is option B. Every 2 hours. Frequent repositioning is the primary way to prevent the development of pressure injuries. Question 10. What is the clinical definition of hematuria? Option A. Sugar in the urine. Option B. Protein in the urine. Option C. Blood in the urine. Option D. Bacteria in the urine. The correct answer is option C. Blood in the urine. Hematuria can indicate infection, injury, or other serious medical conditions in the urinary tract. Question 11. What does the term dysuria mean? Option A, painful or difficult urination. Option B, a frequent urination at night. Option C, large amounts of urine. Option D, a scant or small amounts of urine. The correct answer is option A, painful or difficult urination. Dysuria is a common symptom of a urinary tract infection. Question 12. What is the difference between polyuria and oliguria? Option A, polyuria is scant urine and oliguria is large amounts. Option B, polyuria is large amounts of urine and oliguria is scant amounts. Option C, polyuria is bloody urine and oliguria is clear urine. Option D, there is no difference between the two terms. The correct answer is option B. Polyuria is large amounts of urine and oliguria is scant amounts. Polyuria often occurs in diabetes, while oliguria can signal kidney failure or dehydration. Question 13. What is the medical definition of dysphagia? Option A, difficulty speaking. Option B, difficulty swallowing. Option C, inability to urinate. Option D, painful digestion. The correct answer is option B, difficulty swallowing. Dysphagia refers to a medical condition where swallowing is difficult or painful. Question 14. Which term describes the swelling of body tissues with water? Option A, dehydration. Option B, regurgitation. Option C, dysphagia. Option D, edema. The correct answer is option D, edema. Edema is the medical term for fluid retention that causes swelling in body tissues. Question 15. Regurgitation is best defined as which of the following? Option A, the process of breathing out. Option B, the forward flow of blood through the heart. Option C, the backward flow of stomach contents into the mouth. Option D, the movement of fluid into the lungs. The correct answer is option C, the backward flow of stomach contents into the mouth. Regurgitation occurs when food or stomach acid travels back up the esophagus into the mouth. Question 16. Which nutrient provides the body with its primary source of energy and fiber? Option A, proteins. Option B, fats. Option C, carbohydrates. Option D, vitamins. The correct answer is option C, carbohydrates. Carbohydrates are the main energy source for the body and provide necessary dietary fiber. Question 17. Which nutrient is primarily responsible for providing a concentrated source of energy? Option A, fats. Option B, minerals. Option C, proteins. Option D, water. The correct answer is option A, fats. Fats provide a dense source of energy and help the body absorb certain vitamins. Question 18. Which nutrient is essential for tissue growth and repair? Option A, carbohydrates. Option B, fats. Option C, protein. Option D, fiber. The correct answer is option C, protein. Proteins are the building blocks of the body and are necessary for maintaining and repairing tissues. Question 19. A clear liquid diet includes foods that are at body temperature and do what? Option A, leave large amounts of residue. Option B, are thick and creamy. Option C, leave small amounts of residue and are usually transparent. Option D, consist only of pureed meats. The correct answer is option C, leave small amounts of residue and are usually transparent. Clear liquid diets consist of transparent fluids that are easy to digest and leave minimal residue. Question 20. A full liquid diet consists of which of the following? Option A, only water and clear broth. Option B, foods that are liquid at room temperature or melt at body temperature. Option C, solid foods that have been blended. Option D, high fiber grains and vegetables. The correct answer is option B, foods that are liquid at room temperature or melt at body temperature. Full liquid diets include clear liquids plus items like milk, puddings, and strained soups. Question 21. Which statement best describes a pureed diet? Option A, foods that are served raw. Option B of foods that have a baby food consistency. Option C of foods that are high in spices and flavor. Option D of foods that consist only of clear liquids. The correct answer is option B, foods that have a baby food consistency. Pureed diets are for residents with chewing or swallowing issues and consist of smooth, blended foods. Question 22. A mechanical soft diet is designed for which of the following? Option A, residents who are nothing by mouth. Option B, residents who require high-calorie snacks. Option C, residents who need semi-solid foods that are easily digested. Option D, residents who can only consume clear liquids. The correct answer is option C, residents who need semi-solid foods that are easily digested. Mechanical soft diets feature foods that are easy to chew and swallow, such as ground meats. Question 23. A bland diet is characterized by which of the following? Option A, foods that are very spicy. Option B, foods that are served at very hot temperatures. Option C, foods that are non-irritating and served at moderate temperatures. Option D, foods that are high in fiber and seeds. The correct answer is option C, foods that are non-irritating and served at moderate temperatures. Bland diets avoid irritants like caffeine, spices, and high fiber to soothe the digestive tract. Question 24. When feeding a resident, how full should the spoon be? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, 2/3 full. The correct answer is option A, 1/3 full. Small portions on the spoon prevent choking and allow the resident to chew effectively. Question 25. What is a nasogastric tube? Option A, a tube placed through the abdomen into the stomach. Option B, a tube used to provide oxygen through the nose. Option C, a feeding tube inserted through the nose into the stomach. Option D, a tube used to drain urine from the bladder. The correct answer is option C, a feeding tube inserted through the nose into the stomach. Nasogastric tubes are used for short-term enteral nutrition through the nasal passage. Question 26. What is a gastrostomy tube? Option A, a tube inserted through the nose. Option B, a feeding tube inserted through a surgical opening in the stomach. Option C, a tube used for intravenous fluids. Option D, a tube used to monitor heart rate. The correct answer is option B, a feeding tube inserted through a surgical opening in the stomach. Gastrostomy tubes are used for long-term feeding through an opening in the abdominal wall. Question 27. In terms of thickened liquids, which is true about honey and nectar consistencies? Option A, honey is thinner than nectar. Option B, nectar is thicker than honey. Option C, honey is thicker and nectar is thinner. Option D, they are the same thickness. The correct answer is option C, honey is thicker and nectar is thinner. Liquid consistencies are graded to help prevent aspiration. Honey is thicker than nectar. Question 28. What is the average normal oral temperature for an adult? Option A, 97.6 degrees Fahrenheit. Option B, 98.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option B, 98.6 degrees Fahrenheit. The standard average temperature taken by mouth is 98.6 degrees. Question 29. What is the average normal rectal temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 100.6 degrees Fahrenheit. The correct answer is option C, 99.6 degrees Fahrenheit. Rectal temperatures are generally 1 degree higher than oral temperatures. Question 30. What is the average normal axillary temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option B, 97.6 degrees Fahrenheit. Axillary temperatures are generally 1 degree lower than oral temperatures. Question 31. What is the average normal tympanic temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 99.6 degrees Fahrenheit. Option C, 97.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option A, 98.6 degrees Fahrenheit. Tympanic or ear temperatures are usually the same as oral temperatures. Question 32. What is the average normal temporal temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option C, 99.6 degrees Fahrenheit. Temporal or forehead scans are generally similar to rectal temperatures. Question 33. What color is the tip of a rectal thermometer? Option A, blue. Option B, green. Option C, red. Option D, yellow. The correct answer is option C, red. Red coating is the universal standard to identify rectal thermometers to prevent cross-contamination. Question 34. What color is the tip of an oral thermometer? Option A, red. Option B, blue. Option C, green. Option D, white. The correct answer is option B, blue. Blue coating identifies thermometers intended for oral or axillary use. Question 35. How long should a digital or electronic rectal thermometer stay in place? Option A, until the instrument beeps. Option B, 5 minutes. Option C, 10 minutes. Option D, 2 minutes. The correct answer is option A, until the instrument beeps. Modern electronic thermometers signal with a beep when the maximum temperature is reached. Question 36. When should you avoid taking a rectal temperature because it might stimulate the vagus nerve? Option A, if the resident has a headache. Option B, if the resident has a heart condition. Option C, if the resident has a broken leg. Option D, if the resident is hungry. The correct answer is option B, if the resident has a heart condition. Vagal stimulation can cause a dangerous drop in heart rate in residents with cardiac issues. Question 37. What is the normal pulse rate range for a healthy adult? Option A of 40 to 60 beats per minute. Option B of 100 to 140 beats per minute. Option C, 60 to 100 beats per minute. Option D, 80 to 120 beats per minute. The correct answer is option C, 60 to 100 beats per minute. A resting heart rate between 60 and 100 is considered normal for an adult. Question 38. How long should you count a radial pulse if the rhythm is regular? Option A, 15 seconds. Option B, 30 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option B, 30 seconds. Multiplying a 30-second count by 2 is an efficient way to get the heart rate if it is regular.